Hey everybody, and welcome back to another video here at Whiteboard Medicine. We appreciate you checking it out. Today we thought we would dive into all things E. coli. For those of you not familiar with this is a bacteria that's caused a bunch of outbreaks recently, so it's kind of been all over the news. So we thought in the video today we would talk about E. coli. Specifically, we're going to talk about outbreaks in the past, current outbreaks, foods that are often found to have outbreaks. We're going to then dive into what E. coli is, the diseases it causes, those symptoms of those diseases, how it's transmitted, what groups are at particular risk, what treatments are available, and then how to prevent that. So that's what we're going to discuss in the video today. Hopefully, a lot to be learned and lots of things to take from it so we could better understand some of the news articles out there circulating. No further ado, quick 30-second break for introduction. Don't go anywhere. We'll see you right back. Hey everybody, and welcome to Whiteboard Medicine. We appreciate you checking out the video. Here at Whiteboard Medicine, our goal is to create medical education content for all types of interested learners. That includes videos, practice questions, study resources, and much more. We would love for you to join our community by subscribing, hit that bell button. We're also working to build a high-yield Patreon page. It's going to be full of practice questions, video outlines, notes, commercial-free content, and much more.
None of these videos are intended to be acted upon as medical advice. Please pause the video here and read this disclaimer in its entirety before moving.
All right, thanks for sticking around. So with no further ado, we're going to jump into point one here, and that is outbreaks. So E. coli in the news has been circulating around as causing a number of outbreaks of infections in people. It's difficult to pinpoint the number of outbreaks in general, kind of in the history of us tracking these types of things. But these disease outbreaks do happen, and they do happen relatively frequently. When we were trying to figure this out, there were a couple articles we came across, and we will certainly link them in the video description, but they are cited here. Both were actually published in this Emerging Infectious Diseases journal. This is the first citation, that's the second citation. And these folks actually looked at the number of outbreaks, first from 1982 to 2002. And what they found was that in this time frame, there's 350 outbreaks that encompassed, a little more than 8,500 cases. Interestingly enough, about 20% of those individuals needed to be hospitalized, so 1 in 5. 4% of them got hemolytic uremic syndrome, which is something we're going to talk about. It can be a very, very serious kind of sub-disease or complication of getting infected with a certain type of E. coli. And then 0.5% of these individuals actually died. So a lower number, but still obviously too many. When they looked at how the disease was transmitted during these outbreaks, more than half was foodborne. And that's often what we see in the news. Currently we'll get into it, but there's an outbreak from carrots. That's the most recent one. So lots of these are foodborne outbreaks. 21% of them, the transmission route was unknown. 14% of them were person to person. And we're going to get into this too, because this is a disease that can be transmitted person to person, particularly through the fecal-oral route, which is something we'll talk about. About 10% were waterborne, contaminated water. 3% were animal contact. And then a very small amount were laboratory related. The food vehicle for about 40% of them was ground beef. And you'll see this throughout this discussion. Beef is a big contributor of these outbreaks because E. coli is in the gut of humans and cows, so it can contaminate the meat. And then 21% were produce. More recently, we're actually seeing more produce. As we mentioned, we'll mention again, carrots is a current outbreak. We've been seeing more produce cases lately. So that was till 2002. These individuals then came back and did it again, 2003 to 2012. And what they found was that there were 390 outbreaks during this time, which was almost 5,000 illnesses. 1,272 had to be hospitalized and 33 died during this period of time. Okay, transmission was mostly through food, 65%. 10% was person-to-person contact. All right, 10% was animal contact, 4% was water, and 11% was unknown. Okay, beef and leafy vegetables were the biggest source of infections, and were the source of more than 25% of all recorded E. coli outbreaks and more than 40% of food-related illnesses in general. So if we compare these two time periods, right, this is the more recent period as compared to this period, obviously, what we can see here is that some of the patterns are very similar. 52% were from food compared to 65%. So a little more of these outbreaks were from food. You can see that 21% were unknown, whereas now the unknown is much lower, okay, 11%. Means we're getting better at being able to detect what they're coming from. 14% were person to person, 10% here, so maybe a little better hygienic practices, decreasing the person to person ability. 9% were waterborne here. And in this cohort, where is it? 4% were waterborne. So again, decrease in waterborne, decrease in person-to-person, decrease in animal contact, all to suggest that we're getting a little better at controlling this, but still having a lot of outbreaks. The other thing that's interesting is there's 350 outbreaks with almost 9,000 cases. Here there's 390 outbreaks with only 5,000 cases. So getting better at containing outbreaks as well, probably because we can identify them earlier. So as mentioned, there have been a number of outbreaks actually in the last couple months. The most recent one is this outbreak from actually this month in organic carrots. So as we mentioned, produce is becoming a more common cause of outbreaks of E. coli. And then this is just from the FDA. They said, don't eat some of these brands with recalled organic carrots supplied by this farm. We're certainly not making a comment on that, but that is just what the FDA has put out there. And this outbreak itself, one person has already been passed, has died from it, and dozens have been sickened by this outbreak. So E. coli is something that can cause severe disease and can cause deaths, and we still see a bunch of outbreaks, even though we're getting better with kind of cleaner water, right? So less outbreaks from water, kind of better hygiene, less person-to-person outbreaks, and then each outbreak seems to cause less illness, so fewer people kind of get sick with each outbreak. At least that's what the data above would demonstrate or suggest. Something just to note here is this O121H19. We're going to talk about what this means because with E. coli, you often see E. coli, then an O number, H number. And we'll talk about what that nomenclature is suggesting and how they come up with that. All right, so what is E. coli now that we've talked about all these outbreaks? Well, E. coli actually stands for Escherichia coli. That's what the E stands for, Escherichia. And then coli. It's a very common bacteria, right? This is in comparison to virus, fungus, parasite. It is a bacteria, and as we know, bacteria often are responsive to antibiotics, unlike some of these other microbes. So it's a very common bacteria. Most often it's harmless. We have tons of E. coli in our GI tract, as quote-unquote normal flora. They do nothing. They're harmless. They hang out in our GI tract. In some cases, they may even be helpful. We have, obviously, a microbiome within our GI tract, amongst other places, skin, lungs, all sorts of stuff. And E. coli is no different. So it lives in our GI tract and does not often cause issues. If we're talking about what kind of bacteria it is what we call a gram-negative bacillus. Right? For short, in the hospital, you sometimes say GNB. And there's many gram-negative bacilli, the plural of bacillus. And all this means is when you do a gram stain, which is a way in which you can stain bacteria to help identify them, it is gram-negative, or it's not staining. And that is a reflection of the type of molecules on the outside of the bacteria. So if we were to draw E. coli, this is just a little drawing we did. Obviously, we're not the best artists, but let's see if we can zoom in a little. There we go. So what we can see is it's a bacillus, right? Bacillus are oval in shape compared to a coccus or cocci. So there's cocci, which are circular in shape, and then there's bacilli, which are oval in shape. So E. coli is a bacillus. E. coli has a cell wall, which is the green thing here, and then an outer membrane. And this is why it's gram-negative. It's not staining because it has a little different structure with the cell wall and outer membrane as compared to those that are gram-positive or positive gram staining. On the outside of E. coli is all these purple little molecules, and these are called LPS, or lipopolysaccharides. The reason I'm pointing this out is because LPS can be very toxic, very inflammatory. They can cause the immune system kind of go haywire. So these lipopolysaccharide can cause a robust immune response when E. coli is infecting a human or someone else. And then on the outside of the E. coli is these flagella, right? These kind of yellow-orange flagella, which helps E. coli maneuver around. They kind of can think about it as quote-unquote swimming, even though it's not really that good of a description, but it helps the E. coli maneuver around. So some of the interesting things about E. coli is the flagella and then the lipopolysaccharide, which lipopolysaccharide are not unique to E. coli. Many gram-negative bacteria have it, but it is something to take note of. All right, let's zoom back out here to just the normal. And when we talk about E. coli, this is the structure. We talk about a couple other things, though. We mentioned it's a normal flora in the guts of humans. Actually, all kind of warm-blooded mammals have E. coli as normal flora, not disease-causing. But there's hundreds of different strains and subtypes. Some of these strains, as we'll talk about, do cause disease. Most of them, though, do not. When we talk about E. coli, we often talk about this O and H, right? So a big E. coli strain that people talk about is O157H7. What this is referring to, the O is based on the lipopolysaccharide on the outside, right? We mentioned that all these kind of purple molecules are lipopolysaccharide. The O refers to a kind of certain subtype of lipopolysaccharide. So there's O157, which implies there's 12157. This outbreak was caused by O121, so the lipopolysaccharide on the outside of the E. coli is this 121 structure. The H is based on the structure of the flagella, right? So LPS is O, flagella is H, right? So H7 is kind of the structure 7 of the flagella. This outbreak up here was H19. Right? So this is all in a way to describe the different subtypes or strains of E. coli. And the O and H are based on the lipopolysaccharide and the flagella on the outside of that specific subtype of bacteria. Another thing to note is that we mentioned their normal flora in the GI tract. And when they're in the GI tract, these benign strains don't cause disease. But when they escape the GI tract, even if it's a benign strain, they can cause disease. Many of you out there might have had E. coli in your urine, causing a urinary tract infection. Or another way we say that in medicine is cystitis. So they can cause urinary tract infections. When they escape the GI tract and get into the lungs, they can cause pneumonia. When they escape the inside of the intestines and get into the abdominal cavity, they can cause peritonitis. Sometimes people get diverticulitis. This is where you get a diverticula, which is kind of an outpouching of the intestine. If these is the intestine here, you get these kind of diverticula, which are outpouchings of the intestine. If these get clogged up, they can get all inflamed. And if they get inflamed, they can cause bacteria to build up, and you can get E. coli diverticulitis. They can get in the blood and cause bacteremia. And all these things, you can get pretty sick. You can get septic, you can get septic shock, you can even die. So when they're within the GI tract, they're good normal flora. If they escape the GI tract, they can cause disease all over the body. All right. Within the GI tract, though, if you have a strain or subtype that is not benign, it can cause diarrheal disease. Right, so there's these kind of feared strains. Fear is maybe a strong word, but these are strains that even inside the GI tract can cause disease, right, based on the O's and H's. If they have O's and H's that are more pathogenic, more disease-causing or inflammatory-causing, that can cause diarrhea. These are 5 of the more common feared strains: ETEC, EPEC, EIEC, and EHEC or STEC. Right? Fun to just abbreviate them and say them. What they stand for, though, is ETEC is enterotoxigenic E. coli. EPEC is enteropathogenic E. coli. This is enteroinvasive E. coli. And this is enterohemorrhagic E. coli, also known as Shiga toxin E. coli. Names are less important, but all these can cause, different types of diarrhea, right? So enterotoxigenic E. coli, or ETEC, causes that classic traveler's diarrhea. You get home from a trip in a place you don't spend a lot of time in, and you come and you get just, profuse watery diarrhea. That's traveler's diarrhea, and that's usually caused by enterotoxigenic or ETEC E. coli, right? This is usually self-resolving, usually goes away on its own. You got to stay hydrated, but most people don't get critically ill from this. An interesting stat is you actually need to ingest almost 100 million MO microbes. So 100 million E. coli, ETEC E. coli bacteria to get infected and cause traveler's diarrhea. So this is a huge number, right? You need this huge inoculum to actually cause disease. EPEC, or enteropathogenic, also causes watery diarrhea, more so often in infants and kids. Enteroinvasive E. coli, EIEC, it's fairly uncommon. It can invade the intestinal walls, and this can sometimes cause bloody diarrhea, as compared to ETEC and EPEC, which are watery diarrhea. There isn't usually blood in it. The most feared strain, though, is EHEC, or enterohemorrhagic E. coli, also known as STEC, Shiga toxin producing E. coli. This is most feared because of this Shiga toxin that it produces, right? I don't know if people have followed the news and remembered O157H7, so E. coli O, which is the lipopolysaccharide designation 157, H, which is the flagella designation 7. And this has caused a number of outbreaks where people can get really sick. So many of the outbreaks we talk about are from STEC or EHEC because they produce the Shiga toxin, which can make people really, really sick, which we'll talk more about. All right, so that's an intro into what E. coli is, also known as Escherichia coli. Now let's talk about the diseases and symptoms it can cause. When I think about this, the way in my head it makes the most sense is if we break it down into the GI tract and then outside the GI tract, right? Because we said even benign strains, or strains that usually don't cause any disease within the GI tract, if they escape the GI tract, they can cause disease in a lot of different places in the body. So the first diseases we talk about were cystitis, or urinary tract infection, right? This can be a common thing that can occur if E. coli escape the GI tract and get into the urine. This can also happen. They have the flagella, right? We said E. coli, and they have all these flagella, which help them maneuver and swim. So actually can swim up the urethra into the bladder and cause infection as well. If they get into the lungs, let's say you accidentally aspirate a little in, or if they get into the lungs in another way, they can cause pneumonia or infection of the lung. If they get outside the intestine into the belly, they can cause peritonitis, or infection of the peritoneum, or the abdominal space. If they get in the blood, they can cause bacteremia. And all these things can be severe, right? All these can cause sepsis, septic shock, death. There's times we're in the hospital and in the intensive care unit, right? The area of the hospital that has some of the sickest patients. Some of those patients are so sick because they have E. coli. That's whether it's peritonitis, pneumonia, bacteremia, or cystitis. You can get septic from having E. coli, and it can be very, very serious, okay? But within the GI tract, you have these strains of E. coli that are not normal flora, right? That can make you sick. The ones we talked about, like ETEC, EPEC, EIEC, and these can cause diarrheal illnesses, right? So the diseases are generic diarrheal illnesses, and we divided them up into the scary bad one, right, which is the Shiga toxin producing, and this is EHEC or STEC, right, that O157H7 and other subtypes. This is the more serious one that can cause severe disease. These are more the watery diarrheas, traveler's diarrhea, and all those that can happen. Okay, ETEC, EPEC, EIC. So for these, the diseases are diarrheal illness. The symptoms are often watery diarrhea, very rarely bloody. You sometimes get mild stomach cramps. It can actually last 1 to 2 weeks, but it's very uncommon for it to be bloody. It almost always self-resolves. And unless you're immunocompromised, super old, super young, unable to hydrate, it usually does not cause severe disease. Okay? EHEC or STEC, right, the Shiga toxin producing, or the more serious one, often causes bloody diarrhea, severe stomach cramps, vomiting. It can be very serious. It can cause very severe disease, right? People can die from this, all right? One of the feared complications is something called HUS, or Hemolytic Uremic Syndrome. This is a little complex to think about, but you often get EHEC or STEC, Shiga toxin producing E. coli, and about 3 to 10 days later, you start to develop worsening symptoms. You might be urinating a little less. You might start to feel fatigued. You might have skin discoloration. And all this might suggest that you're developing hemolytic uremic syndrome. And that is because of the Shiga toxin. Okay? Right? We said this is Shiga toxin producing. And what happens, this is a blood vessel right here, right? So we have blood vessels all throughout our body. These are red blood cells. These are platelets. These are endothelial cells. Endothelial cells line our blood vessels, And when Shiga toxin gets into the blood, it starts to affect the endothelial cells, and it starts to cause damage, both direct cytotoxic damage, that Shiga toxin destroys those endothelial cells. It causes this huge immune response, cytokines. It can cause complement, which is another part of the immune system. And all this starts to injure and destroy these blood vessels. Activates platelets, right? So you start to destroy your endothelial cells, right? Instead of being these nice smooth cells lining the blood vessel, they start to get all jagged and broken down. That then activates platelets that kind of grow and start to form blood clot. And all that starts to lead to what we call MAHA. MAHA stands for microangiopathic, all right, big word, hemolytic anemia. And all this means is that in your small blood vessels, right, your small angiopathic blood vessels, you start to hemolyze or burst the red blood cells, leading to low hemoglobin or low red blood cells. So if you picture it, you kind of got these clots clogging up the blood vessels. If you try to squeeze a red blood cell through here, it can't fit. So that red blood cell starts to get broken down. It hemolyzes, and it leads to a decrease in the number of red blood cells, right, or anemia. It also leads to thrombocytopenia, or a decrease in the number of platelets, because the platelets are all being consumed with these blood clots that are forming from all the inflammation. Okay, this disproportionately affects the kidneys, and it can cause kidney injury or renal dysfunction, and sometimes can affect the brain too and cause CNS dysfunction. So that's central nervous system, CNS. So all of this can be very serious. It can be deadly, and there's no good treatment. Treatment is supportive. You support the body the best you can, because antibiotics tend to not be given, because what you worry about with giving antibiotics is that you're going to burst open all these E. coli bacteria, and they're just going to release more and more Shiga toxin that then is going to cause an overwhelming increase in this process happening and can lead to death. Mortality is about 5%, so 1 in 20 people can die from this. Mortality is a little lower these days. We're better at taking care of folks, but still can be mortality. And then 25% in some studies are estimated to have kind of permanent kidney injury. So serious thing, can be deadly, and it is particular to this EHEC or STEC, right? EHEC stands for enterohemorrhagic, right? E. coli, and then STEC stands for Shiga toxin producing E. coli, right? And this is the EC is E. coli. And that's the Shiga toxin is what's really kind of messing us up here and causing this disease. Ooh, low battery. That's not good. I'm going to plug it in. All right, we're all plugged in. So how do we transmit E. coli? How do you catch E. coli, right? Because that's something we should know so we could try to avoid it. Well, a big thing is fecal to oral route, and that means feces contaminate other things that then we get in our mouth and consume unintentionally. That can be directly contaminated surfaces, right? That can be contaminated water, and this can be both human and animal feces, warm-blooded mammals like cattle. Contaminated produce, sometimes from the manure that people are using to fertilize fields, and nothing against fertilizing fields with manure at all. But that is how this E. coli can sometimes get in there. And then human to human, right? Not that I would ever do this, but let's hypothetically say I have E. coli, I have a bowel movement, I don't wash my hands, I shake someone's hand down the road, they then don't wash their hands before they eat dinner, and they eat dinner and consume the E. coli that I accidentally put on their hands, right? So human to human transmission. The outbreaks we see are most often foodborne. We're eating food that is contaminated and that's not well washed or what have you. And the at-risk groups, the people who are most affected by this, are the young, the old, the immunocompromised, and then international travelers who maybe are exposed to strains of E. coli they aren't often exposed to, right? That kind of quote-unquote traveler's diarrhea that people talk about. People with intact immune systems who aren't young or old can still get really sick from this, but these are the groups that are more at risk. So how do we treat it and how do we prevent it? Let's talk about prevention first. So prevention is more straightforward, and it's kind of the 5 things that the World Health Organization talks about. Keep clean, right? Cleanliness, good hygiene, wash your hands, all those things. Separate raw and cooked food, because raw food can have E. coli on it, right? If you have E. coli in the animal is then butchered, and that E. coli can get on the meat. After it is cooked, cooking kills the bacteria if it's cooked thoroughly. So if you separate the raw and cooked food, you won't contaminate your cooked food. Cook it thoroughly. Store at safe temperatures, just so that if there is E. coli there, it can't grow as you're waiting to cook it. And then use safe water. Obviously, this is not something everybody has access to, but using safe water can avoid consuming that contaminated water. Goodness forbid you get E. coli. What should you do about it? How do you treat it? Well, it depends on the location and the severity. Remember we talked about diseases outside the GI tract versus within the GI tract. So outside the GI tract, you treat these infections with antibiotics, right? That's a UTI or cystitis. That's pneumonia, PNA pneumonia. That's bacteremia, right? Sepsis, peritonitis or infection within the belly. All these you treat with antibiotics. Because E. coli is a bacteria, it causes disease, and it's killed by antibiotics. If it's within the GI tract causing these diarrheal diseases, it depends, right? If the diarrhea is watery, aka not bloody, and it's mild to moderate, the recommendation is to just stay hydrated and monitor yourself to not give antibiotics. Antibiotics have risks, right? Antibiotics can lead to worsening infections from other bacteria. It can lead to antibiotic resistance. There are side effects to these medications. So mild to moderate disease, hydration and monitoring, it should self-resolve. Severe disease, though, possibly antibiotics. So still stay hydrated, still monitor yourself, but possibly antibiotics. And severe disease is often defined by, a large number of diarrheal stools per day, needing to be admitted from dehydration, being immunocompromised or elderly, having more systemic symptoms like high fevers from this. So severe disease, consideration for antibiotics. Mild to moderate disease in the watery bowel movements, hydrate and monitor. If the bowel movements are bloody, though, this raises the risk for the EHEC or Shiga toxin producing E. coli, and sometimes entero-invasive E. coli can cause bloody diarrhea as well. If it is EHEC or STEC, it is supportive care and you want to avoid antibiotics. As we said, the Shiga toxin is what causes a lot of the very severe pathology from this strain. And if we give antibiotics, right, if you have a bunch of E. coli full of Shiga toxin, right, and they're hanging out, and you give antibiotics and you lyse all these E. coli all at once, and they just release a huge amount of Shiga toxin, that can cause an overwhelming negative response that can lead to death. So often antibiotics are avoided. Oh, sorry, ABX. This is our hospital abbreviation. We didn't write it out. ABX is antibiotics. Now, there's a lot of nuance here. So it's not a hard and fast rule, but that is often what is recommended. All right, hopefully that was interesting, informative. Let us know what thoughts, comments, questions you have down below. Let us know if you know or have had E. coli infection in the past. We'd love to hear from you. Subscribe, hit the bell button, check out our other videos. We got a recent video on sepsis we put out, which is related to this. We'll link it in the video description. In any case, stay well, keep learning. We'll see you next time.